transfer board. This one is made of wood. You can see that the ends of it are tapered. That just assists the patient in being able to get on and off it more easily. A transfer board sometimes is made of plastic. Sometimes they're longer or shorter, just depending on the patient's needs. Either way, they're used basically in the same way, and they all basically look the same. And what you would do with this, I'm not going to demonstrate it for you right now. I will do that in another video. But what you do with this is it's basically bridging the gap for the patient between surfaces, maybe between their bed and a chair, or going back from the chair to the bed. And you slide one end of it under one of the patient's buttocks, and then they're helping with the transfer, and they're just sliding across the surface while you use the gait belt and help them to slide across that surface. It can be done very safely and effectively. It's not hard for the patient to use, but I do want to point out that this is used on a patient who would not be bearing weight for whatever reason, would not be putting weight through their legs, either because they're not able to because of an injury, or they just are too weak to do that or too large to do that. These boards need to be used on patients who do have good upper body strength, upper trunk strength, because they do need to be able to control their trunk for balance while they're moving. You won't be able to do that for them. They need to be able to do that while you assist them in sliding across. Another device, which I guess we could call it a device, sometimes you can use the bed, if it's an electric bed, to your advantage in helping to move or transfer a patient. Many of the beds now in facilities are electric. Keep in mind that you can use the settings on these beds to make your transfer easier. If you need to lower the bed so that the patient, so you can have their feet reach the ground, you can go ahead and lower the bed down. If you need to raise the bed to even out surfaces between transfer heights, do that. The bed can also be used to assist you if you're trying to raise, get the patient up into a sitting position. You can raise the head of the bed, and that way the patient is in more of a sitting position to get you started, so the bed can raise up. Please don't do that if we're working with this patient on the functional goal of getting from laying down to sitting up. And hopefully if we are, we've made you aware of that. But if that's not a goal of the patient's and it just makes it easier for you, please use the settings on the bed to assist with that. You can also use the foot side of the bed and raise that up just to have gravity help you if you're trying to move the patient up in bed. If they need to be repositioned or shifted up in bed, leave the head of the bed down, raise the foot of the bed up, and that way gravity is helping, and you can get them sometimes to help too by pushing, and it's just an easier transfer and an easier move. Another device that can be used to assist you in moving the patient is called a lifter sheet or a draw sheet. A draw sheet is basically just a flat sheet that's been folded in quarters or in halves, and it's placed under the patient so that with the assist of another caregiver, you can slide that patient forward in bed or readjust and position them better. Make sure that when you place the draw sheet under the patient that you've got the folded edge up towards their head or their neck and the unfolded edge down near their knees. We won't put this one under the patient because there's already one placed there. When we do this, we want to make sure that we have the bed up to a position that's comfortable for us and isn't putting strain on our backs. And we'd also want to lower the arm rails, the bed rails, so that they're not in our way. Remember, we want to explain to our patient what we're doing and just let her know that we're just both here to help reposition her in bed and to help her feel more comfortable. The draw sheet needs to be untucked. And then just kind of fold it up alongside. You can explain to your patient that she can just place her arms, fold her arms on her chest or her stomach. And what we're going to do is grasp the draw sheet around the knee and the shoulder area on each side. And what we'd like to do, if the patient can bend their knees, have them bend up just to assist you. That way their feet are in a position where they can help to push as you're pulling them up in bed. Also be aware that you want to remove the pillow and place it at the top of the bed so that it's easier to slide them up, and also they won't have any chance of hitting their head on the headboard of the bed. What we will do is we'll have our feet spread apart for good body mechanics. We'll use our legs and our body to do the movement. And on the count of 3, we'll shift our weight from our back leg to our forward leg while we're sliding her in bed. Now we would explain to our patient as we do this, if you could just push with your legs and help us to slide forward. 1, 2, 3. And then we have her positioned higher up in bed. We'll reposition her pillow so that she's comfortable. Make sure that you pull the draw sheet straight and flatten out any wrinkles so that she's not laying on wrinkles. And then you'd leave this draw sheet in place for future use. Now, just so that you're aware, sometimes these patients, if they're incontinent and they tend to soil or wet the bed, they may have what's called an incontinence pad underneath them. Because it's positioned in about the same place, sometimes this is used as the draw sheet as well. So be aware of that. This is an easy way to move a patient and position them, so don't forget that when you do this type of a movement, get the assist of another caregiver so that you're not injuring yourself. Now, a mechanical device is used on patients where other types of transfers aren't appropriate or where they just wouldn't work. Sometimes the patient is completely immobile. Sometimes they're just too large and it wouldn't be safe to do a 2-person transfer, and then they need a mechanical lift. A mechanical lift is something that usually involves the lift and a sling. The sling is used to position the patient on. They're usually positioned in the middle of the sling. And then there's chains that hook up to the corners of the sling. And then this sling is raised and lowered off of the surface using the mechanical lift. They're very safe, but your patients will need reassuring because nobody's comfortable when they're suspended in air. So keep in mind that when you use a lift, you always use it for short distances, and you always just raise it as high as is necessary to move the patient from surface to surface. Just so you're aware of what some of these look like, this is called a Hoyer lift. This one basically uses a hydraulic action to raise and lower the patient. Sometimes it's a pump, and then you have a valve that you release to slowly lower them to the next surface. There are various types of mechanical lifts, and when you work in a facility, you'll need to become aware of which type of lift they use the most, and make sure that you're trained in that lift and that you're comfortable using it before you attempt to use it with a patient. Most lifts also, facilities require 2 of you to be working with the patient when you're using a lift. Keep in mind that there are things you always need to think about when you're working with patients. There are considerations for the patient and for safety and for the patient's involvement. And hopefully when you're out working, these things will pop into your mind and you'll remember that these are important. If you start doing these as a habit, it will just become a natural way of working, and your job will be more enjoyable to you and more enjoyable for the patients you're working with.
Hi, my name is Terry Walters. I'm an educator at a long-term care and subacute facility. You've just seen the Hoyer lift, the lift that lifts the patient's body completely. Now I'm going to be showing you the standing lift, a lift that can be used to lift a patient from one seated area to another seated area. For example, this lift can be used to lift a patient from the side of the bed to the wheelchair or from the wheelchair to the toilet. Remember that this lift is not meant to be a conveyance, however, so you